Thank you so much. All right, next up. Do the Republican victories mean Democrats will have to take a closer look at GOP health care proposals?
Who better to ask than a doctor who is also a lawmaker? We welcome Republican Representative Phil Roe of Tennessee. Good to see you, Doctor. Thanks for being here. The Republican plan, it's not getting a lot of press in the general media. Do you think it will? And if it doesn't, does it have any chance at all?
Well, David, right now the bill on there is the Democratic bill that we're going to be apparently voting on this weekend. We just got an email right before I came on camera that the Rules Committee will meet at 2 o'clock on Friday of this week. We'll go into general debate on Saturday for 3 hours. Each committee, Education, Labor, which I'm on, Ways and Means, and Energy and Commerce, will each have an hour of debate. And then the Wiener amendment with a single-payer system will have an hour of debate, and then a Republican motion to recommit will have an hour of debate, and apparently we'll vote Saturday, so we'll find out Saturday. I think that's just heard it.
Congressman,
just before I came on camera.
That's interesting news. Now, do you expect to see a scaled-back health reform bill that sort of looks like a consumer protection kind of a bill instead, where you don't have, these rescissions going on?
Here, I brought the bill with me again, and here's the bill. It's now over 2,000 pages with a manager's amendment, and I've been reading this bill. I read the first 1,000 pages, and David and Liz, it's almost ridiculous. I could go through here. I mean, it even lists, you put the nutritional aspects on a vending machine. It even mentions donuts and pizza, and I mean, it's in every phase of your life, and there's a biofuels tax credit in a health care bill. I mean, this is ridiculous. And it is so complicated that the American people, my physician friends, can't understand it. So we need to start back up and do some fairly simple things we can all agree on, and that the American people can understand, and doesn't micromanage every phase of your health care life, so to say. And at the end of the day, when you go to your doctor, someone comes to me and they get undressed and I examine them, am I going to be able to offer them better health care? And the answer is no. And if you look at this bill where you cut $400 to $500 billion out of Medicare, and then you tax devices, and the tax increases and no tort reform, at the end of the day, certainly our seniors can answer this question. When you take that much money out, you add 3 to 3.5 million people per year, and you cut the physicians' reimbursement by 25%, their access and their quality is going to go down, and their costs are going to go up.
Congressman, Doctor, you brought us this breaking news that this weekend is going to be the vote. Do you have any idea how it's going to shake out? We just talked to a Blue Dog Democrat who has a lot of problems with this bill. If it's forced to a vote this weekend, he's likely to vote against it.
I certainly know Jason well, and is on the Education and Labor Committee. I think he will. I think many conservative Democrats will, certainly in our neck of the woods in Tennessee and Virginia and Alabama, Georgia, and so forth, Kentucky, surrounding areas. And the reason is not because all of us don't want health care reform. We want health care reform that works and doesn't put government in control of every phase of your health care choices, which is what it's going to do. And I've said it from the day I got here. We need to do this right, not fast. And secondly, we need to have patients and doctors, not the government and insurance companies, in between health care decisions.
Dr. Phil Roe, Congressman from the state of Tennessee. Thank you very much, Doctor. Appreciate it.
Thank you, Congressman.